Hi there, I'm Dr. Dennis Wolf and I'm going to talk to you today about compression garments that are involved in the aftercare process of VASER and fat transfer. As you can see in our lovely patient, they come in various shapes and sizes. The colours are generally black and tan, and depending on what areas are treated, we have different shapes and sizes of different types of garments. They are closed by hook and eye noose on the sides, and they often come with straps to keep the garments in place. It's important to make sure that garments are kept in place above and below the area that has been treated. They're made of a thin lycra material which is breathable, it's not conspicuous under clothes, and generally very comfortable to wear under things like suits if you need to. Occasionally I get patients to wear foam inserts, and these inserts are basically there to apply slightly more pressure in the areas that have been treated. Depending on what posture you take, occasionally we'll get creases in certain parts of the body, and to prevent those from leaving permanent marks and features, I get them to wear these pieces of foam, and these can be cut and tailor-made to exactly what size you need. Essentially they are wrapped around or placed into the area that is required. What this also does is it makes sure that your posture is nice and upright and prevents you from sitting in a very hunched position like that. Because of its fairly stable foam, it keeps you in a nice upright position and makes you really comfortable. I tend to recommend that you wear these for the first 2 weeks if required. Like I said, we tailor-make the post-operative care to every patient's needs and requirements, and depending on what area you have treated, we can guide you on what garments you will require to wear. So after the treatment, you'll be padded up with very thick pads, usually of this size, all around the tummy, underneath the compression garment, and these will be remaining in place for the first 24 hours, during which the leakage is the most. After that, they can be replaced with these smaller ones. Those will be sufficient for the trickle that will take place from day 2 onwards. So remember that once you leave the clinic, you'll be really padded up, possibly look like Michelin Man, but this is only for the first 24 hours, and after that these can all be replaced by smaller padding which will then absorb all the trickle that will take place. So you'll look fairly normal after the first 24 hours. So I'm just going to show you how these garments are open and closed. There's generally a hook and eye combination. They're easily opened and closed. Generally you should do this lying down with some pressure from behind so you can apply the garment correctly. I'm going to show you now where the access points for the treatments are on an abdomen. I tend to make 2 in the lower part of the tummy, and these are usually in the bikini line so they're not visible. 1 or 2 in the umbilicus, again they're in the umbilicus so they heal very nicely, and then 1 on each side underneath the breast crease. And this is where you really need to place the padding to absorb any of the leakage of the material. And that will be of this type after the first 48 hours, during which the leakage will simmer down to just a trickle. I'm going to show you now the access points for outer thighs. Generally I'll place 1 in the buttocks crease, and then 1 in the underwear line just up here, and that allows me to treat this whole area here. The padding initially will be placed into these particular areas, and then again can be replaced by smaller pads of this size. I'm going to show you where the access points for the flanks are. I generally place 1 just above the buttocks crease, and then 1 on each hip. These again are in the underwear line, so they're not not visible at all. The padding is placed into these positions for the first 24 hours, and then can be replaced by these smaller pads. In the case of the back, I often apply a thicker padding or a piece of foam that will just give you the nice contour of the lower part of the back, which really sculpts that out, so it's important to wear that. So I'm going to show you the access points for when I treat the outer thighs. We generally do 1 on each side of the buttocks crease, which is nicely hidden, 1 on the outer thigh in the underwear line. And in those places, again, the padding for the first 24 hours will be quite significant to absorb any of the leakage. The majority of the leakage will come from this access point. You hardly tend to get any leakage from that. And then after the first day, a small amount of padding like that is going to be sufficient to absorb any of the trickling that will take place. This is an example of the actual compression garment that you can see. It generally fits under normal clothing and is not very conspicuous under work clothes. If you do go to the gym after the first 2 weeks, you can certainly take this off, and I recommend having probably 2 so you can alternate, wash 1 and wear 1. I'm going to show you where the access points are for the treatment of the arms and the posterior auxiliary fold. I tend to place 1 just into this crease So when the arm is in this flat position, the access point is not noticed at all. The only time you'll see it is when you raise your arm and you'll see the access point in this position. The other access point is in this part of the elbow, and this is where the majority of the leakage will take place because of gravitational effects. So the leakage that occurs here is very negligible. The majority of the leakage will take place from here. The compression garment involves the whole arm, and obviously leakage will occur from both sides.